Okay, perfect. So maybe then now I can start. And yeah, so good afternoon, everyone, and a very warm welcome to all of you all gathered here today. And it is really nice that you all could join this event here. So today, as you know, the theme of today's event is innovating for growth, deep tech solutions in healthcare. So this is co-organized with my colleague Heidi Hinsala from the LENTOON project, and also myself in collaboration with WUST in the DEETECHTIVE project. So we have two interesting, I would say, talks today. One is from Tuomas Planman. Tuomas Planman is actually the startup and network manager at Business Finland. So he will be mainly dwelling into the development of deep tech companies in healthcare, public funding, and other support available. So his title of his topic will be Deep Tech Startups Innovating for Growth. So I would say it is a great target audience for the SMEs who would like to apply for funding and all of those cases. And secondly, we have Professor Dariusz, who is the Dean of Faculty of Medicine at Warsaw University of Science and Technology. So Professor Dariusz will be basically dwelling into the dynamic synergy between, technology and medicine, with the focus of innovating technologies that are emerging from WUST University. So that will be a very interesting insight for, people in the academic field and also, in the technological field who are in the industry. So it's a mix of both, I would say. Yeah. So I would say the agenda for today is the talk starts with Thomas Planman, who will be talking about deep tech startups. So I think then we'll have a Q&A session after each talk. For the Q&A, feel free to add your questions in the chat, and I will then, once the talk is done, I will read it to the speaker, and then we can then move forward with that. So yeah, so Thomas, I would give the floor to you. So feel free.
Okay, thank you very much, and good afternoon, everybody, and nice to be here. Thanks for the invitation. I'll just try to share this presentation. Just a second. So now you can probably see the presentation. Okay.
Yes, we can.
Okay, very good. So yes, I'm Thomas Planman, and I work at Business Finland as a startup network manager, focusing especially on health and deep tech startups. And going to talk a little bit about Business Finland first, in briefly, then about the deep tech companies, and especially health companies, what to consider, and then focus on the Business Finland and other public support and services available. So starting with Business Finland, briefly, Business Finland is here to generate prosperity for Finland, accelerating the growth of our customers, including some companies and research organizations also as well. And there's lots of different services available, funding, of course, that most people know about. Also the support for export and international business, creating networks and ecosystems, also attracting investments to Finland, promoting tourism, and attracting talents. So quite a lot going on. But then mainly for startups, the most relevant services are funding for R&D and business development projects, and also this advice and networks for expanding into new markets and thinking about internationalization. And here's just about our funding. Sorry, this one is in Finnish, but for last year that there's been over 700 million euros funding, also close to 100 million euros for startups and 140 for other SMEs. So definitely also startups and SMEs are big focus. So then about deep tech, a few words about deep tech, about new innovations that can kind of revolutionize industries or have big impacts. So there's quite many definitions about deep tech, what it is. And I think here's one that basically it's fundamentally new science and engineering making its way into products and companies for the first time. So if you think about in the past, things like electricity when it got started, or semiconductors, so those could be some big examples. Of course, there's some smaller but still significant ones as well. Usually these can be quite high risk and also high reward endeavors, need a lot of capital, R&D work, also some skills in the science and technology, and also business skills to make things happen. And some areas include, of course, artificial intelligence, biotech, and some other healthcare inventions, quantum computing, energy solutions, and others. So here I gathered a few things to keep in mind as a deep tech startup. Probably not a fully complete list, as there's many things, but some highlights for, at least from my perspective, that it's always good to focus not only on the technology or the research, but on the value proposition. Say for the example of electricity, if you could transmit power, you can run machines and you can light up cities, or if you have a new treatment for certain disease, you could help cure that or treat that, and so forth. So that there should be some type of value created. Then of course the research findings and technology development is important part. Start having some objective results and prove that this seems to work. If it works in the lab, could it be something that works also in kind of bigger, larger scale? And always getting some results to also convince others, financiers and partners and future customers that this could actually work and provide some value. Then of course the customers and market potential, even the best, most interesting research or technology might not make it to a good product or business if there's no end users and buyers. And especially for healthcare solutions, there's typically several different stakeholders that you need to convince. There could be the end users, such as patients, or also some doctors and professionals, some influencers like key opinion leaders, payers, whether they're public reimbursement or private insurance companies, also some regulators that need to make sure that the solution is safe and meets the other criteria for the market. And also think about the competitive advantage. Usually if there's some big potential and there might be some competition already there or emerging, that what would be your competitive advantage, not just now, but in the coming years and even decades, if it's very kind of big new invention. And one source of competitive advantage and characteristic of deep tech companies is the intellectual property that comes in many forms. Maybe the most well known is this registered IP, such as patents, patent applications, and trademarks, and so on. One other important thing is to ensure the freedom to operate, that you're not infringing other people's or companies' patents. And there's also other intellectual property that is not registered as patents, and doesn't always make sense to patent everything, because patents are also public information. So some things you can keep as trade secrets, such as code and software, some data, and research results, and some know-how, whether it's about process or manufacturing and so forth. Then in the healthcare arena, certainly the regulatory environment is always important to keep in mind. And as with many of these other things, you not necessarily can solve everything immediately, but rather think of it in a long-term kind of roadmap. That what would it take to get this solution approved? That is it a certain type of classification of the product? Will you need some clinical studies? What type of studies? Do you need to have a quality management system? And you can actually talk with some expert companies or even with some of the regulators about these topics, and at least to have a good plan to execute and then update along the way. And of course, to then do this and advance, you will need some resources and to make some progress. Of course, important thing is the team and partners. So it's very good to have the research expertise, but also some perhaps the technology or process commercialization know-how, and also about the business and business development and how to develop startups, how to approach investors and fundraising and those type of things. It's usually good to have people with some experience and also open mind to learn quickly. Funding is of course needed. Business Finland provides some public funding, and there's also some private funding needed. So business angels and venture capital firms, some also invest in deep tech companies and also in health. And then of course reaching milestones regarding all of these things, whether it's the some research findings, some new results, some technology increasing the readiness level, commercial milestones, getting some pilots or getting some feedback from customers is always then valuable to obtain also more funding and resources and strengthen the team and continue on the journey. So at the Business Finland, I think deep tech companies have been supported for already a long time. So we have the R&D grants and loans available for companies doing R&D work, also some other funding, and also some the support in internationalization. I'll tell a bit more about this shortly. Then recently we have a deep tech campaign ongoing where we want to contact deep tech companies, and they can approach us and we can give some advice and help tailor the services for funding and otherwise to support the companies. We have a dedicated funding instrument currently in piloting Deep Tech Accelerator. Currently it's over 1 million euro in grants and loans. I'll tell a bit more about that also shortly. And now also Deep Tech has been added as a clear target group for us in startup companies this year. So what we're searching for, some of the Business Finland customer criteria on the left, some of the general ones and particular ones on deep tech on the right. So first of all, there should be a competitive advantage in international markets, and so you should know about the market and some other solutions, other research, other products on the market, and be able to articulate why you could be different. And of course, nobody needs to know the whole global market from the day one, but at least know some of the main players and have a kind of a good hypothesis of how we could create even more value and be competitive. Then to have an impact on Finland, so whether it's employment, future exports, and tax revenues is always important, since Business Finland is using the taxpayers' money to start with. The competence and team is important, as I also mentioned earlier, that it's also evaluated at Business Finland. Having a focus in investing in R&D has also now recently been raised as a main criteria also for startups. And the ability to raise private funding, also since Business Finland funding is only for part of the project, so companies should be able and ready to raise also private funding, and to have the commitment for international growth. So not only aiming for domestic markets. And then in addition, few criteria for deep tech companies, in particular, the business idea based on the latest research, having a strong IP that can be in many forms, as I showed earlier, that the team in balance with the research and business talent, and there can be quite high risk in the technology and also in the market, but that there is high potential as well, some breakthrough possibility. And so then about the services, so the funding is perhaps one of the most used one, and it's certainly useful for startups and deep tech companies. Always company needs to be registered in Finland, and the funding is always for a project, so not for a company in general, but there should be a project plan and budget. And usually about 50 to 70% of the budget we can finance. There's competition between the application, and there's a bit of different funding for different purposes, whether it's R&D or commercialization. I have a few examples here. So for startups and young companies, these are a few of the most typical funding instruments. We have the Tempo funding for exploring markets, R&D for research and development, and then also some funding for scaling up and commercialization. So starting with the Tempo funding, it's quite often used as a first funding instrument with Business Finland. It can be used to further test the kind of demand for the product, talk with some customers, international customers preferably, also finding out about more financing, private financing also, and doing some IP analysis and regulatory analysis can be included also, and a little bit of technology development if it's needed. And here's the main criteria on the right. It's meant to be quite straightforward to apply for that, and it's maximum 80,000 euro project with 60,000 euro grant from Business Finland. Then the R&D funding is perhaps one of the most used funding instruments. So if you have a company that's doing R&D work, it's always useful to consider this R&D funding. So it's quite versatile for even starting from research and then developing of products or services, production methods, so forth. Usually about a year long, can be also longer, certainly for more mature companies. And these projects can be, you can have several of these. For Tempo, it's usually only one project per company. And this R&D funding can range from a couple €100,000 to up to several millions. And it can be grant or a loan. So whether it's a grant or a loan depends on whether the project is more research focused on the left. If it's still creating new information and not yet resulting in a final product, then it can be possible to apply for the grant funding. Then on the right, if it's more kind of development focused, already creating new products, then it's a loan funding. And a project is always either or, it's not a combination, but depending on which type of work is done most. And it can be used for many different things. So starting from even laboratory studies and research, product design, developing hardware or software, prototyping and testing, process development, IP protection, so the first patent applications, piloting, even preclinical and clinical studies. Also some business development work can be included, and we strongly encourage to include it. For example, doing the regulatory plans and FTO analysis, continuing on the market, updating business plan. And lots of different costs can be included, starting from salaries and travel and materials and equipments. Also purchased services, which makes sense to use, especially with IP, doing this IP analysis and also IP filings. Some quality and regulatory expert companies, also some design services and testing or even clinical studies from companies or universities or research organizations can be included. Then another suitable instrument for deep tech companies is into funding that I'll just mention also briefly here. That's meant for IP development work. It's not very well known, but one good thing about this funding instrument on the top right, that this one can be used for even the national states patent filing costs. So if you have a patent family that's in the PCT phase and you're planning to file in US and Europe and Asia and other countries, then it can be quite costly. So those costs can be included in this one, as well as kind of comprehensive IP strategy update. So that's good to keep in mind at a suitable stage. Then for scaling the business, we have young innovative company funding, which is for startups under 5 years with a scalable business model, and also some evidence of promising business and paying customers. This is a maximum 1 million euro grant, so 75% of the project. So quite a good funding instrument also for companies. But this meeting this 5-year timeline for health companies or deep tech companies can be quite challenging sometimes to get on the markets. So at the moment we're actually piloting a new funding instrument called Deep Tech Accelerator with the pilot that started in spring last year, and we'll see if it's continued also this year and going forward. That's meant also for the commercial side of the work, in addition to the R&D projects, for example, to work on the customer segmentations and secure pilot projects, develop the business sales and marketing, and also put a lot more efforts in the strengthening also the commercial team and acquiring external funding. For this also the company needs to be under 5 years, but doesn't need to have revenue yet, but rather should have kind of deep tech foundations and the strong IP and research base, and aiming for significant impact. And this is also over 1 million in grants and loans in few stages. So there's quite many options. So might be hard to think that what is the right one, and usually there's not a single right one, but they can be used together and in a sequence. So here's one example. There can also be different ones. So starting from the left, at the founding of the company and some pre-seed funding on the bottom, could start already with some tempo funding if it's needed, or if not, start directly with a research grant project, obtain some more seed investment. Then on the blue track, kind of the R&D track, it's always good to think about that if you're doing R&D, then to apply for more to develop the actual product and develop future versions and so on. And then on the yellow, this Deep Tech Accelerator can be used to supplement that to accelerate the growth. And in addition, it's possible to use the into funding, for example, and also other ones like the light blue one, co-innovation, and on the top some EU fundings, typically a little bit later on. So this can be used in sequence and in some cases in parallel. And we're happy to advise companies in what funding would be the best for them and at what stage. Now about the Deep Tech Accelerator, I wanted to mention a few examples here since that pilot started. So we have a news release also out. There's the link that these companies were selected for the pilot. And actually 8 out of these 17 companies are in the health and well-being area. So certainly also based on this and others, the health and well-being is a major area for high quality research and also commercialization in Finland that we're also happy to see and support going forward. And most of these companies also have some websites available and some public information that you can also check out if interested. So in addition to the funding, as mentioned, so the other main thing is that we have support for the international market. So we have personnel in Finland focusing on different industries, and also people around the world who know about the local markets and have connections there. So some ways to use this is to get some of the contacts and networks, for example, for piloting or get some key opinion leader connections, even contact some of the regulators and so forth, and get some advice and business intelligence. Also, we publish market opportunities. So if a certain country is, for example, building a new hospital and sourcing certain equipment, we could have a news about that. And so there's lots other than funding also available. And there's more info on that also on the website. And we're also happy to coach and support companies in finding the right services for the right market at the right time. Sorry, is there a question? Maybe just some noise. So about the Team Finland, Business Finland is also part of the Team Finland network. So there's the ELY centers and Business Finland, Finvera, TE services, and also the foreign ministry as the core partners. Also some various other partners there. So the link to Team Finland, who can also support in funding and in internationalization in various ways. So here, wrapping up with a few kind of practical tips. So it's a good idea to get to know the funding instruments online. Think about what's the stage of your company and the purpose of the funding and what it could be used for. For example, for Tempo, it's quite clear that what it could be used for there on the right. And yes, to think about the company needs first, and then we can find out the suitable funding or other support for that. Reasonable size and duration of the project, because the self-financing for the project needs to be secured. So I think, as I mentioned earlier, Business Finland can take quite a lot of risk, also technology risk and market risk. But the type of project risk that the company would run out of money in the middle of the project, we practically cannot take at all. So the funding for the duration of the project should be secured. And then also it's possible to apply for other funding later on. And to apply basically for any of our fundings, you need to describe the business. So what is the need? What is your approach? What are the benefits? What's the competition? So we have an online application form for that. The project plan is a main attachment. As I mentioned, we only fund projects, so there should be a plan. What is the purpose? What is the content? What will be the results? Resources, what will you do internally? What will you buy? And then some key financials. This near-term cash budget that I was referring to, and also some long-term business projections. Of course, they always have some insecurities that, but based on the kind of best information at the moment, if you can make your solution work, what kind of business could you create? Starting from top down is one way that we could get like 1% of this market or 5%, but then even better could be bottom up, that who could be your first customers, like which clinics or in which countries, and what would they buy, how much would they pay per unit, why would it make sense for them, and then go from there. Kind of a bottom up projections. And then to plan the private funding in parallel for the project and working capital. It's possible to contact Business Finland and even start working on a project plan before securing all the private funding. And it can be even beneficial to work kind of in parallel. So you can make the kind of plans that work for you as a company, and they work for the private investor, and they also work for the Business Finland funding. So we can be contacted for advice before filing the applications. And there's the link, just the businessfinland.fi from the first page. It's easy to get to the startups or SMEs or research organizations. And on the startup page, we have recently been updating that one, and we also have our contact info there. So you can also find my email address there, so you can be also directly in touch. So I think that's about it for now, and happy to answer any questions and discuss. Thanks.
Thank you, Thomas. So I think in the Q&A we have one question. So it's from Ville. So does patent landscape make sense for startups, or is it tool only for corporations?
Yes, I think it makes good sense. So with the intellectual property, like I mentioned a bit earlier, that it's not only about your own patents, but also knowing about the patents of the competitors and knowing about the other research. And patents are a very useful source of information also. So you don't develop something that has already been developed. There might be a patent application somewhere that might not even be granted as a patent, but somebody has already published that. So it can be certainly useful to do a patent landscape early on, and then continue updating that, and then maybe do a bit more formal, the kind of freedom to operate analysis to look at the patents in force that you might have a risk of infringing them. So certainly it's useful also for startups.
So if maybe we have time for maybe one more question. So if anyone has a question, please, you can feel free to open your mic and actually ask the question.
Well, I'd like to ask about how have Business Finland previously thought about publishing in science, because that's important for any students or researchers that are still possibly hoping to carry on in academia. So how are those risks mitigated in relation to the IP rights that need to be maintained for being fundable?
Mm-hmm. Yeah, very good point and a good question. So it's certainly possible to publish, and even recommended in some cases to be able to publish and show the results to the world, but then to protect them before publishing to the extent possible, and even think a little bit about that, what you need to publish, and if some things you need to keep as a trade secret, like some detailed algorithms or details about the process. If it might make sense to keep them as confidential, it's good to consider that one also. So in that case, if it's still a university-based invention and research, it's good to contact the innovation services who can help also with the assessment and protecting, even filing some patent applications while in the university before publishing, and then to take that into account, maybe sometimes even pushing back some publication a little bit and thinking about the content to be able to secure the good broad kind of patents for the future commercialization. Because as I mentioned, that the deep tech companies quite often need substantial funding. So to be able to get the funding, there should be some possibility to get a return on that funding. And for that, it's very useful to have some IP rights then to be able to run that business, and not just that it's some VC invests millions to that and it's free for everybody to use, then that wouldn't work.
Yes, thank you, and thank you for the talk. It was amazing.
Yeah, sure, thanks.
Thank you a lot. I think, do we have a time for question? or we should.
Maybe we are perfectly on schedule and we do not have any hands.
Okay, let's stay in schedule. I can ask separately.
Yeah,
Thank
also you
you.
can ask in the chat or then contact me afterwards if any questions. So thanks.
Thank you.
So great. So now we have Professor Dariusz, who can maybe take the stage and speak for the next hour.
Hello, everybody. My name is Dariusz Jagielski. I am a cardiologist. At the same time, I am the person who works for Wrocław University of Science and Technology, and at present I'm at the dean of the new opened Faculty of Medicine. But please, first of all, tell me if everything's all right with my presentation. Do you see that?
Yes, we can see it, Dariusz. Perfect.
Okay. All right. So let me start with something which I called synergy between technical and medical worlds. And of course, it will be very subjective. It will be my point of view. But I would like to introduce you to the situation which is taking place right now in Wrocław, because we just started last year something which is totally new at the map of science and education in Poland. It means we opened the second medical faculty because one already exists. I will tell you something about it pretty soon. And we have quite a new situation when the technical university, Polytechnic, the proper and the whole name is Wrocław University of Science and Technology. This university opened Faculty of Medicine. So at the beginning, I will tell you a little bit of the history. I will try to tell you what was the grant for such a decision, how it looks like, what we are doing. And of course, I will try also to persuade you that there is a huge synergy between those two worlds, technical and medical. I'm pretty sure most of them do agree with me. So let's start something about the history. We moved to Wrocław, or somebody would love to see the previous name of the city, like Breslau. City had many names in 1945, and at that time it was constructed one school after the Second World War. It was University and Polytechnic in Wrocław, and during this few years it was also opened Faculty of Medicine, which started in 1945 with 607 students, students of medicine. The first dean of this department was Professor Hirschfeld, who was at that time very well known in medicine. He was educated in many Western German and Swiss universities. He was helping people fight epidemic during the First World War. Then he started a lot of research concerning blood groups, immunity, blood clotting, and in 1950 he was even nominated for the Nobel Prize in Medicine for explaining phenomenon of serological conflict. After a few years, in 1950, the medicine left this school, University and Polytechnic, and after a short time, those two academic groups splitted and existed separately as University, Wrocław University, and Politechnika Wrocławska, Wrocław University of Science and Technology. Just to tell you a few words, a few numbers, HealthTech, we call it sometimes in abbreviation, has more than 22,000 students, more than 2,300 academic teaching staff, and almost 5,000 employees altogether. We have 15 faculties, and we are also the part of the Unite group, which concerns different university from Aalto, from Lisboa, Torino, Barcelona, and some other cities across the Europe. HealthTech has rich cooperation with many almost 30 national centers, but also more than 60 foreign centers in Europe, and also has quite rich cooperation with more than 30 universities across Europe under the Erasmus program. One might ask, what is the idea which forced the people who governed the HealthTech to open the medicine at the Wrocław University of Science and Technology? First of all, I would answer that medicine and technology lived together for many, many years. They are living now, and they will live, because I cannot imagine the medicine existing and developing without new technologies. This is quite natural for many of us. And of course, we don't have to break the wall. We just could go somewhere to other big universities in Europe, like in Munich, like Dresden, like in London, in Switzerland, but also in other countries like UK, like United States, like MIT, and many others, when medicine exists with technical branches for many, many years, almost forever. But there are, of course, many other reasons. Between them, there is also that HealthTech had, during last 5-6 years, more than 120 projects which were thematically related to medicine. So there is a lot of experience between different faculties, like chemistry, like mechanical faculty, like fundamental problems of technologies and medicine. So they are almost always very close, or even together. Just to tell you a few sentences, a few words, how it started. Of course, a few years ago, more than 4 or 5, even more years ago, the rector and the people from the government of the HealthTech were already thinking about opening Faculty of Medicine, but almost 2 years ago, the final decision was done, and Polytechnica signed agreement with some hospitals. Then it was started renovation of some buildings. Then the Ministry of Education and Sciences agreed to open the program of teaching medicine at our technical university. And then October the 1st last year, we started with the first group of 60 students who entered our HealthTech university. We could ask ourselves, what are the differences between our Faculty of Medicine and many others? First of all, I think it would be very honest to say that this is classical medical education. So there are people who don't understand from the very beginning why medicine at the technical university, so they think that will be just technical education. Of course not. It will be classical medical education, but also that will be some things which are very unique for our Faculty of Medicine. One of them is that we start showing to our students the medical world from the very beginning. So this is from first year, even from first semester, we want the students to go to the patients, to the hospitals, and to see this medical world from the very scratch. We have also something which we call tutoring, which is of course very obvious for most of them, if not for all of us, but in Poland it's not very popular. If yes, there are just some technical universities, but at the medical schools it's not so popular. We start from a very beginning, from the first year, to show to our students modern technical technologies. I will tell about it a little bit later on. But at the same time, we are not forgetting about so-called what we call humanization of medicine. It means that medicine, it's not only the new technologies, but also this is the way how we talk, how we communicate with the patients, with patients' families, between each other, between the medical staff. This is very, very important, and we also put a great amount of energy to teach this to our students. Of course, these modern methods of teaching medicine consists of many other things, like using medical simulation equipment, like making or using virtual microscopy workrooms, virtual dissection workrooms, like using laboratory of the living tissue sections, using virtual, augmenting, and mixed workrooms, and many, many others. We, of course, are very precise if we want to be good in teaching. It means we have plenty of staff. Right now, more than 200 people staying with us at the WUST University of Science and Technology, more than 60 professors and habilitating doctors, professors of the university. We have also the technical staff, which is, of course, very important while teaching the students the basic sciences like chemistry, biochemistry, physics, biophysics, and so on. So for the time being, you could even say that we have much more employees than students, and this is true. But of course, during the coming years, we are going to build our second and the next years, and soon the students will be much bigger than the amount of the employees. As I showed you before, 4th of September, we had a very important celebration because we opened our Faculty of Medicine. This is the picture showing the rector, Professor Vuis, and the other previous rector, Professor Więckowski, which were together with us opening the Faculty of Medicine. And it was really a very big day for us, even or especially because this day was celebrating not only in Wrocław University of Science and Technology, but also in media in Poland, local media in Medium, which is the magazine showing the life of medicine in Lower Silesia, where we are coming from. The structure of the faculty is quite standard. We have one dean, we have 3 vice deans, and also we have a few departments. For the time being, there are 6 departments: preclinical sciences, social sciences, neuroscience, clinical sciences which are not surgical, clinical sciences which are surgical or invasive treatment. We have the oncology and hematology. Of course, we have the Council of the Faculty of Medicine, Council for the Discipline of Medical Scientists, but also, which is unique at the Technical University, we have Clinical Affairs Council, because of course we have hospitals and we are going to spend a lot of time, I mean our students the teaching out of the Technical University, but directly in hospitals. One could ask what is the story with the places where the students will be taught the true clinical medicine, and the answer is quite simple. For the time being, there was no decision to build its own hospital. There is no need like that for the time being. We made agreement with 8 partnerships medical centers between Polytechnica and 7 hospitals. You can see over here this picture the names of those hospitals and also the picture. Some of them are the true one, like my own. I'm coming from 4th Military Hospital in Wrocław, but there is also one, the visualization of the future oncology and hematology center for 1,000 something like around 1,000 beds, and it will be one of the biggest oncological and hematological centers in Middle Europe. Altogether, we have quite a big amount of beds which can be for use for our students, for our patients. Altogether, this is more than 300, and it's of course not a matter how many beds we have, but the quality of the medicine which is being practiced in these hospitals. But the number of beds also is quite important, which I will tell you in a moment once again. From the very beginning, we were very proud because we were not 100% sure that the recruitment would be very successful. Of course, there are many people thinking that if something is opened, just open, and there's this new one, the quality of the education might be not so good, but it was just opposite. We had the biggest amount of people finishing the high school, 29 people over one free place at our Faculty of Medicine. So it was really huge success for us. And this is the story I've told you a few minutes ago, that our students who are having not only tutoring, but we are opening from the very beginning the student scientific clubs, and we are trying to show them the modern technologies. And in one of the students club, the students who want to become the surgeons in the future, they have a possibility to get in contact with the robotics like Da Vinci, and soon within the few weeks probably we will be able to show him also the second one, which is called Hugo. We're teaching our students in many different ways. We are teaching classical medicine, classical anatomy, like dissection or using anatomical specimen, but also we are using the animal specimens, we are using 3D tables, virtual reality, but also we are trying to use ultrasound techniques to show them how real organs are working. And we think this complex way of teaching the anatomy gives the students a lot of possibility to learn the anatomy as fast and as good as possible. Of course, we are trying to use other things, like we are trying to use plastinates, which are very nicely prepared and comparing to classical anatomical specimens. This is a very efficient way of learning detailed structures of anatomy. This slide was very important for us because last September, it was the first time when we just opened our faculty, and Professor Bladowska taking part in one of the biggest radiological symposium congress in Vienna. She was able for the first time to show our Faculty of Medicine at the Wrocław University of Science and Technology in public. So it was a big discussion, a lot of questions, a lot of emails, and we're very proud to show to the world for the first time that Wrocław has this Faculty of Medicine at the Technical University. Of course, those worlds are going to each other, and are close to each other, and they are developing, and we are developing also different kind of cooperation with other universities. We already have some ties with Technische Universität München, with University of Arizona, with Ariel University, with Avicenna University in Georgia, and some other schools which are discussing or changing a letter of intentions, and we're trying to develop this cooperation because this is very important for us and for our students and future doctors. One of the most important thing for us was a few days visit in TUM, in Technische Universität München. As you, I'm sure, know, this is one of the biggest polytechnic in the world, in one of the ranking, the biggest one in Europe, and also this is one of the biggest medicine in Europe, not only in Europe. They have a lot of knowledge, a lot of know-how, a lot of tradition. They have 18 Nobel Prize winners at TUM, but also what is very important, they have two very big medical branches like Rechts der Isar group of hospitals with 1,200 beds, and the other one, LMU, Ludwigs-Maximilian Universität, which have something like 2,000 beds. So together they have 300, 200s. This is the figure I showed you, I told you a few slides before. What is important, they have a lot of history together, because with the first group, Rechts der Isar, they have the tradition working together started in 1968. So this is more than 50 years. And with the second LMU, they work already more than 20 years. So, but this is very, very important to have so many hospitals and so many doctors close to technical world, and the effects are really obvious. Of course, there are many other bright sides of having those two words together. When our students entered technical university just a few months ago, it would be really hard to imagine to have possibility to have contact with very well-known and important figures of science, of technologies close to each other. Just please take a look at this example. During last 2 years, we had an honor to have such beautiful and well-recognized guests like Professor Maria Makarov, who got the Doctor of Honoris Causa at our technical university. She's president of Academia Europea. we have the chance to have lectures of Professor Muru, who got also doctor's honoris causa, and he's Nobel Prize winner in physics in 2018. We had a few months ago the chance to listen to the beautiful lecture of Professor Ferenc Krausz, who is this year Nobel Prize winner. So we had also Professor Michel Virlogeux, who was honored of Doctor Honoris Causa at the Wrocław University of Science and Technology, and he was the author of those beautiful bridge in Millau Valley in southern France. So this is very important to have just such a chance, especially for young people who just start to learn some science, some medicine, and at the same time they can be so close to such important, very well-known and recognized scientific persons. What we're trying to do to get closer between those two words, we are organizing something like we could say the meetings, when the people from medicine can show what they are doing, what their specialization, what we are trying to reach. But at the same time, we are trying to get them close to the engineers, to programmers, to technical people. And we organized already 6 such meetings. And of course, this is very important because those words are quite different, but when they have a chance to be close to each other, to talk, to say about the problems they are trying to reach or resolve, this is a very nice and fruitful story for both of the sides. This is one of the examples when such a cooperation between neurosurgeons and mathematicians already got a lot of fruits because the problems which were defined by neurosurgeons, how the flow in the brain is going, where to implant, and in which way, under which angle, the bypass in the brain, using the huge knowledge of Professor Magjas, the Dean of the Mathematics, gave beautiful results, and they know that this cooperation is helping people and helping to put the better bypasses on the level of the brain or neurosurgery on place. Of course, as a cardiologist, I could talk to you many things about new technological things which are put on the medical market due to the extreme and efficient work of the technician, of engineers, such an example like trans-aortic valve implantation, like the closures which are closing the interatrial septum or left atrium appendage, and many others. But because I'm not a so-called hemodynamic guy, but just a simple electrophysiologist, let me show you how important in my life was the close relationship between medicine and technical world. I just started from the very nice and at the end a little bit sad or even very sad story with this ECG, where the patients wearing 24-hour ECG, so-called Holter monitoring, or was having the atrial fibrillation. Then he got ventricular fibrillation. Then he unfortunately had the cardiac arrest, and finally, unfortunately, it was not possible to give him a help, and he just passed away. But let's start from the very beginning. As you can see, this is even more than 100 years when there was first ECG registration were possible due to invention of the engineers. Eindhoven discovered and first published the second degree block, atrioventricular block. You can imagine in 1950, not so far in the history of medicine, not so far, not so long away, if patients had atrioventricular block, he had to push such a big amount of box weighing more than 200 kilograms. After a few years, it was just a small box, but still it was possible to put the electrical wires into the heart through the skin. And after a few weeks, after 2-3 years, 3 months, everybody got infection and all of those people were dying. So you can see at this picture at the end of 1950s, it was the first implanted pacemaker. It was in Stockholm, Åke Senning and Rune Elmqvist, and the patient, Arne Larsson, at the end of his life, he died not due to the cardiological problems, but due to cancer. He went through 23 reimplantations of the pacemakers. Also very important was the milestone like invention of implantable cardioverter defibrillators. It was Michel Mirowski, the Polish citizen, who in 1980s implanted for the first time automatic ICD, and it was possible from that time to save the human's life due to the ventricular arrhythmias. Now we have much different equipment like subcutaneous implantable cardioverter defibrillators, but of course there are many other equipment, so-called CIEDs or cardiac implantable electronic devices, like this example, which is leadless pacing, which represents the pacemaker which is implanted directly into the heart without using the electrodes going through the vascular system. And then there are, of course, a lot of equipment like transvenous lead extraction tools to have a chance to withdraw such equipment like pacemakers, like leads, which were dislodged or infected or damaged. There are implantable loop recorders, small devices just for recordings of the electrical activity of the heart for a few months or even for 2, 3, 4 years. There are different kinds, variety of the ablation tools invented, for instance, like over here in 1990s by Shlomo Ben-Haim, Michel Aizeguer, Carlo Papone, and so-called like an example Carto system for 3D visualization of the electrical activity and helping people with atrial fibrillation. There are 2 examples of making such isolation using the high temperature radiofrequency ablation and using the low temperature so-called cryoablations. Just a little bit to go through and finish, there are equipment called cardiac contractility modulation to make the contraction of the heart better, especially in people with heart failure. There are different kind of stimulation, different parts of the human body, like phrenic nerve stimulation used in patients with central sleep apnea syndrome. This is for me especially very important because I was part of the team helping Respicardia company to develop this technology, and it was very big pleasure for me and honor to see how it was working from the very beginning, from the feasibility study just till the end, till putting this equipment on the market. And then finally, I would say that this our relationship between the doctors and the engineers are going, of course, much farther into the future. There are plenty of new things which are going around, like different kind of automatic recognition of the speech when the young doctor is going and having the history taken from the patients, and then he's not able, he doesn't have anymore, or she doesn't have anymore to go and write directly into the computer, because this software is doing itself for a doctor, like different kind of 3D reconstruction of the human anatomy, when the doctors are trying to prepare themselves for the surgery, which is going to take place within a few minutes or hours or the next day. And we are able, using 3D reconstruction and VR, AR, mixed-art technology, to visualize the human body, the complex of the human body, and be prepared much better and prepare and perform afterwards this procedure much safer. We're running, of course, different projects with our technical colleagues, like, for example, this project which we called X projects, when we are trying to write the equipment or software to automatically recognize the electronic devices and which are implanted to the human's body, into the human's vasculature system, into the human's heart, and then to help radiologists to describe what's going on, because sometimes there are so many different situations that they are not able to learn all of the possibilities, and sometimes they have just directly don't have enough time to sacrifice to do what the software might be able to do soon. There are at the end also some other things, like, for instance, this Clara projects, which combined the engineers and anesthesiologists and electrophysiologists to have the better control over the putting to sleep the patients, and to automatically administration of the anesthesia to help the doctors and operators to perform different kind of surgery or electrophysiological equipment. Of course, there are many other such examples. We don't have much time, but we do believe, and we see that those two words are merging, and the ideas which are being born in the technical heads and medical heads are being much easier put on the table than in the situation when we would be quite different in different universities. And at the end, if you allow me just a little bit story about the history, we are as the Faculty of Medicine at the campus, the Polytechnical campus, but at the same time we have already our own building, which we have the part of our rooms, or the dean's rooms, you can see from the left hand side. But at the other hand, there's also very interesting history lying behind this story, because this building was constructed more than 100 years ago by a German architect, Max Berg, which was author at the same time of the one of the most beautiful building in Wrocław, the Millennium Hall, which was put on the UNESCO list of the beautiful buildings in Wrocław. So if you're one day visiting Wrocław, you should definitely visit also this hall, which is really, really extremely unique. we are going to have the new building pretty soon, within the next 4 years, with more than 20,000 square meters. But the construction, or just making the architecture story, just started. So for the time being, it's not so easy to show you. But at the end, I would like to summarize and to say, just citing one of our writers, Stanisław Lem, who said that dreams always win over reality when they are allowed to. Thank you very much, and I hope those few words you were able to listen from my side recognize or persuaded you that those words are very close to each other, and they should be very close for our not only students, not for the doctors, but first of all for our people, for our sick people, to whom we are trying to give what is the most important from the medicine and from new technologies in medicine. Thank you very much once again.
Thank you very much, Professor Dariusz. It was very interesting to see the kind of technologies you all are working with, and also on how this collaboration is happening, especially also towards the end when you mentioned about the Millennial Hall. Definitely, I think many of us would really like to visit that place. It looks really beautiful, the building. But on the other hand, does anyone have any questions? I didn't get any questions in chat, but feel free to open your mic and have some kind of questions. So Heidi has a question. Heidi, maybe you could open your mic and ask the question directly, because.
Yeah, I can. Yeah, thank you, Professor Dariusz, for your speech. This really sort of like opens our eyes how deep in the professionality, in the specific professionality you need to be when developing new medical technology. I'm curious about what kind of collaboration are you doing with companies, or are you open for collaboration? You had a huge hospital settings there, for example. Are you doing clinical investigation collaboration, for example?
Yes. Well, of course, the question is very, very good. Thank you very, very much for that. But I would say that there are many, many different ways of cooperation. So let's start from the very simple, which was at the very beginning, when the companies, like the huge players on the market, like Medtronic, Boston Scientific, Abbott, and so on, they were developing new technologies and just coming to hospitals. It was for many years, and of course we were also a part of the clinical trials to show that this technology is working. But it was already the stage after developing those technologies, which were developed somewhere else. But right now we see more and more companies which are coming to our hospitals, and they have just the proof of concept. So this is just very, very first stage, and they don't need, for the time being, for today, making clinical research in hospitals, because it's a little bit too early. They want to work with the doctors and start also some theoretical consideration, but also sometimes some testing, medical testing, or in already vitro situation, if any equipment is working. And also, again, if we wouldn't be so close to the technical world, which we are right now, so it would be just the situation when the technical world from outside, from different cities, different countries, are coming to us and ask about working together. Of course, it's still possible. Of course it is. But now we have one more thing which is close to very just over the window, over the wall, because we are meeting those people, engineers, informaticians, and many other technical stuff, which is working just in the same building sometimes. So we can start working together from the very beginning, from the plan, from thinking how such a modern technology should be, and then we can construct proof of the concept together, and then we can march, we can go together for the next steps on development of new technologies. And this is very exciting, believe me.
Thank you.
So any other questions? Maybe one question. If not, then I can give the floor to maybe Rashad. You can start off with the closing words of what you missed in the start.
Yeah. Let's see. Thank you everyone for the event. Thank you our speakers. Very informative, very impressive, I have to say. And sorry about the slight difficulties in the beginning. It's funny how one is never immune to these. Nevertheless, I believe it was a fairly successful event, and yeah, we will probably continue with our next events in June or August, but you'll be updated on those. And I would like to thank our partners, Centria Hub, for organizing this event, and once again, our speakers. Thank you very much.
Thank you very much for inviting me.
Thank
It was
you,
a very
everyone.
big
Thank you.
pleasure. So I'm very proud. Thank you.
Pleasure.
Thank you, Dariusz.
Thank you. Oh, we seem to have a question from Camille. He raised a hand.
Oh, okay.
Feel free to turn on your mic and speak up, or you can just write in the chat.
No, it's only thank you for the meeting. Bye.
All right. That was goodbye. Yeah. All right. See you. Bye-bye.
Bye.
Thanks. Bye-bye.
Okay, thank you. Goodbye.